So our next speaker, Neroli Ellis, is from the Australian Nursing and Midwifery Federation, and she's here to talk to give us an overview of the perspective from the health and community sector. Neroli is the elected secretary of the Australian Nursing and Midwifery Federation Tasmanian branch, a position she has held for over 14 years. She is also CEO of the Education Division at ANMF, Health Education and Research Centre, and an RTO providing health training. Thank you, Neroli.
Thanks very much, and thanks for inviting me to speak today. It's something I'm really passionate about. Being a nurse is actually talking about some of the hazards, but I'm actually even more passionate about what do we do about them. And we've got a lot, as you probably know. Everyone knows a nurse, and we work under pretty torrid conditions out there and do the best we can under those conditions. Look, I think I'm not surprised that health's in the top 10, and that's what does flabbergast me is that with the Tasmanian health system, we've only got one workplace health consultant for 5,000 employees in the south, and yet we're the number one in the sector of injuries, and yet we've got such poor emphasis, particularly in the public sector. In fact, our private sector and aged care sector are doing better than our public sector in regards to workplace health and safety. Just by way of introduction, what's our environment like for nurses? Don't forget that we work everywhere across Tasmania. So we can work in acute hospitals, in theatre suites, in emergency departments, in psychiatric areas. I've got to compete next door, I think. We work in families' homes, in rural, remote areas, right across the board. We're working, and particularly, obviously, all of those have got specific risks involved in them. Can you hear me, or do I have to go louder? Bit of a competition, I think, next door. But the environment that we're in is constantly changing as well, and there's huge pressures and demands in our sector because we cannot turn patients away. So wherever we're working, we're seeing overcrowding and demands and work intensification, and no relief in that with our demographic in our Tasmanian society. And what we do is provide a managed care, so we can't control that, and that's one of the issues. In many areas you can control your workloads, but it's completely out of control for us, and we have to do the best we can in that environment. And the environment includes budget cuts, funding cuts. You probably know that hopefully that we've got a whole range of lack of beds and capacity at the moment, so that leads to overcrowding in our emergency departments. We've got staff shortages at the moment, where we've got 40% of our staff on fixed-term contracts at the Royal in the ED area, so we've got a whole range of staff shortage issues, an ageing workforce and increasing demands. So it's not looking too healthy at the moment. I was just admiring the hazards you have, but we have a range of those hazards as well, with just as toxic chemicals, just as bad lifting. All of those same hazards are there for nurses, and predominantly being a female, it's at high risk the whole time. And many nurses, we talk about our nurses' back. Nurses do have bad backs, and it's the environment we work in. And it's always been accepted that nurses at a certain age would have the nurses' back. But it's completely unacceptable now for our young generation and for all of our nurses to be actually thinking that that's normal and normalising that. But it's very much part of our culture as well. So what's our physical hazards? The majority of our hazards are obviously people, environment, etc., manual handling, and we're now dealing with people who are up to 300 kilograms a patient, and they're called bariatric patients now, and we have a whole strategy set in place of how do we deal with people now, our patients, who are on average 120, 180 kilos and up to 300 kilos. And they require beds being bolted together, a whole range of strategies to deal with bariatric patients now, but that's becoming very commonplace right across the board in Tassie hospitals. Obviously, lifting, transferring patients. We're an ageing workforce. We start at 7 o'clock in the morning. We have no warm-up, no routines. We just get straight into it. And the first things you do is actually start moving people in their beds, people around into showers, into small confines, and trying to deal with their hygiene. And they're the first things we do, when it's probably the last thing we should be doing without a warm-up, particularly when we finish the shift the night before at 11 o'clock at night and hardly had time to really recover from that shift the night before. That's normal shift work, though, for nurses. Repetitive strains, obviously that's one of our top issues, hands, wrists, shoulders, etc. And slips, trips and falls is also another one of our major physical hazards. Chemically, we are dealing with a lot of toxic chemicals, and the more that we see new anti-neoplastic agents or cytotoxic therapy coming in, all of those chemicals we're dealing with and handling every day have got really obviously severe ramifications. Gloves that we deal with, so this is for a theatre nurse dealing with latex gloves, wearing latex gloves, dealing with some disinfectants which are glutaraldehyde, which we clean our scopes with. If you have an endoscopy, you need to have those scopes cleaned with some of these incredibly toxic chemicals. Anaesthetic gases alone can, without the appropriate safety mechanism, and they're free floating. Radiation, gamma rays, we're dealing with patients on wards with often with radiation devices internally that we have to deal with as well. So these are all things that are part of our daily work. Other hazards that we have are obviously biological hazards and the exposures to HIV, Hep B, Hep C. Needle stick injuries is one of our biggest occupational hazards, and we deal with a lot of sharps. We can be dealing with sutures, we can be dealing with scalpels or needles that we use all the time, and it's how we manage those, which unfortunately needle stick injuries are still part of our real hazards and risks. So we as shift workers, and I've just mentioned we're working earlys, lates, the average age of the nurse is about 49, so there's a lot of elderly nurses working now trying to manage this shift work as well, up to 75 years of age, I think is our oldest nurse working at the moment. 90% female, so and absenteeism is pretty high at the moment because of the stresses of the environment, and 80% of absenteeism at the moment is due to workloads and stresses. It's not due to anything else at the moment. The other big environmental factor is staffing levels and skill mix, and the huge requirement for overtime and double shifts. The system at the moment means that at the Royal Hobart Hospital there's 10 double shifts being worked every day, and that's 17 hours straight for a nurse. So you can start at 2 o'clock in the afternoon and you get off at 8 o'clock the next morning. That's a double shift, and 10 of those every day are being worked and not managed. That's not healthy for anyone to be doing a double shift, let alone doing them on a regular basis, and that's one component. The rest is all overtime, so you can be working 3-4 hours. Plus then you can be on call. If you're a specialist nurse, you'd be required to come back in during the middle of the night, often between your working days, and often on your weekends off you're required to be called back in because you're a specialist nurse needed for that emergency procedure. We also have nurses working in the rural, remote sector, in community sectors, and unfortunately as part of our claim to the government at the moment is actually pleading to get appropriate protective gear for them. At the moment they're provided with very thin nylon pants, no shoes and a t-shirt top as part of our uniform allowance, and they get a very thin, not even a jacket, it's just a tiny little top really, and that's it. Compare that to what a policeman receives or a paramedic receives, and that's 2 Gore-Tex jackets. I mean, I cannot describe the list of gear that they get to be safe in that outdoor environment compared to what we have to put up with. And we might be working in the back of Queenstown, opening gates in the snow, going up to see those clients in their homes, and it's completely inequitable in regards to the protective gear. A lot of you shaking your heads because you can never imagine this in any other industry, any of these sorts of scenarios, because it's unique. It's unique. Bullying and stress. I should be next door. It's pretty rampant, and one of the major reasons that people do leave the profession. Violence, bullying, and stress is the reason people leave. And isolated work, and we still have nurses going out in the rural and remote areas, any areas on their own in isolation. They can be called out at 2 o'clock in the morning, so our palliative care nurses can be called out on their own. They go. There's no duress alarms, there's no sat phones for them, they're out of contact, and we see that scenario happening, and the horrible stories you hear interstate of the Gail Woodford, the solo post nurse in South Australia that was murdered. So part of our claim industrially now is that we see no single nurses going out at all anymore, and that's unfortunately we've got to go down the industrial lines as opposed to what we think is just a normal workplace health and safety issue. So we're heading that way now. Workloads and lack of resources is a really big issue. So workloads here, we've got a recent survey this year actually from some of our members. 70% have experienced workload issues that are not being managed. And of course that causes stresses as well. Don't forget, nurses are people who want to be able to do their work the best they can, and that's caring for people. So if they can't actually provide the level of care, it's incredible for job satisfaction or dissatisfaction, and it really does impact on them. And it also leads to fatigue, exhaustion and stresses and all those things that you all know about. A recent Monash research in 2016, which is a 3-yearly research that Monash University researchers undertake, shows that 32% were considering to leave the profession this year, when the average industry is 3 to 6%. Due to workloads, 85% are required to work very fast, and that's just demonstrating the work intensification. And 80% are proud of their work, but chronic exposure to workloads and exhaustion have reduced their work engagement, which is impacting on retention. Moving to violence, and I hate to report this, but we're incredibly exposed now to violence, and both verbal and physical now in our changing society. We see now patients on ice, etc. We see patients on drug and alcohol affected. We see patients with mental illness. We see patients with Alzheimer's. They've all got potential to injure nurses, and it's not just that area of those small segment I've mentioned. There's many people now who have are disrespectful and don't treat nurses how they should be, and they can be swearing, abusing and spitting, biting, you name it. In ED, our nurses are exposed every day. The police will come in and drop a client into the emergency department in handcuffs, and the police will leave, and the nurses then have to deal with this aggressive, abusive patient. It's a really big issue, and the research shows 60% of nurses have been assaulted in the last 12 months, and it's still not being addressed. We see a lot of underreporting also, that people are not reporting a lot of these issues. It's again becoming normalised that's okay. On top of these sorts of factors, don't forget the Royal Albert Hospital is a building site as well, so we've got a fair bit of issue around those extra hazards that are being put in front of nurses' daily work. The next slide just shows that many nurses who are not making claims and why they're not making claims. This came from a national research, but it showed that 50% of nurses who are injured don't claim or make a workers' comp claim. And of those 50 that do make claims, only 50% again aren't making the claims, and that's the reasons why they're not making the claims. Many people aren't aware that they should be making claims or reporting it. And a lot of people, not a lot of nurses actually, to make a claim you've got to fill in an incident report online, and after you've done your shift and done your overtime, the last thing you want to do is sit down and record on the forms, etc. So many nurses just don't bother reporting lots of these issues. I'll skip through the next couple of slides because I think we've covered them today, but around health and in the costs of and I know there are some slight improvements here, but I think the underreporting is just getting greater as opposed to having miraculous cures in our health system. And I'd like to just finish with a case study, and I'm not going to say where this is, but it's one of our emergency departments that's under huge pressures at the moment. And it was built for 40,000 presentations. We're now seeing 60,000 presentations, so the physical capacity is pushed every day. This is an area where we've got bed block, which means that patients can't leave emergency because there's nowhere for them to go. So they can't go through to the wards where they're meant to be going. So they all bed block or backlog in and stay in the emergency department. We've had a recent review of the place. It's got patients ramped in the corridors. So you've actually got people on trolleys in corridors where they're not meant to be. You've also got people treated in chairs around all the corridors. So that's also blocking some of the exits. The chairs with patients in them are blocking some of the emergency exit doors. So then you've got nurses and doctors actually treating the patients in the chairs or in the trolleys in the corridors on their knees and trying to get down there to actually provide that level of care that they're requiring. And you've also got equipment backlogged and lined up in corridors as well that everyone has to try and weave through to get there. You've got one shower for 24 admitted patients. There's 2 short-stay patient rooms in areas in the ED, and they've only got one shower between them, so the nurses then have to, and these patients can be there up to 4 or 5 days, so the nurses have got to try and move that around in that finite time as well. So if anyone's got some miracle answers, you can see this is a high-risk area. It's happening right now, and we are absolutely pulling our hair out to know how on earth to address these sorts of scenarios. So obviously nurses are at high risk here from manual handling, potential muscular issues, stress, fatigue, all of the environmental issues, and bullying comes in there too, and violence, because once you've got overcrowding, patients, relatives, families are actually abusing the nurses why they can't go through to the ward or why they can't have the appropriate levels of care. So it's a pretty hot spot. I don't think any other industry would put up with this sort of scenario, but this is what's happening right now in Tasmanian hospitals, and it's completely unacceptable. So I will continue ramping on about it in the media, because I think it's someone's got to do something about it and start taking some responsibility. So I think I'll just finish there. Yes, thank you. Thanks very much. I'm happy to take any questions.